The views and opinions expressed on the show by the host, speakers, and doctor experts do not reflect the views of Johnson & Johnson, Johnson & Johnson Philippines Inc., or its respective management. Viewer discretion is advised.
Here at Johnson's Baby School of Gentle. My name is Saab Magalona Bacaro, and I'm a mom of two boys, Pancho and Vito. I'm sure if you haven't seen my boys online, you can check them out on my Instagram page. It's at Saab Magalona. Ay nako, you guys are gonna fall in love with my kids. They're so cute. I don't know if I'm biased. I'm probably not because they really are just the cutest. Okay, welcome back to another session of the Johnson School of Gentle. And in a few minutes, we will be joined by not one, but two doctors para sagutin ang inyong mga tanong about pregnancy and childbirth sa panahong ito na meron pa ring pandemic. I understand how scary today's situation can be, lalo na sa mga pregnant moms and moms with newborns. I can't imagine what you guys are going through. I'm sure you guys are scared, there's anxiety, there are fears, but what we aim to do right now is to answer any of your questions. So if you have any questions, i-comment nyo lang yan, and we will answer as much as we can later on, especially when our experts come on. Pero bago yan, magkamustahan muna tayo, guys. Sa mga mommies na early birds, thank you for tuning in. We also have mommies watching via Shopee. Hi guys! Ano mga binibili nyo dyan? Huli kayo. Online shopping talaga ang bida ngayong pandemic. No? Hello mommies! Meron kaming surprise para sa inyo mamaya. Kaya naman, stay tuned. Okay, so kamusta kayo mommies? I want to say hi to everyone. Where are you watching from? I want to acknowledge where you're from. Is anyone watching us from abroad, from the provinces? I personally am from Metro Manila. So, mommies, let me know where you're from. Siguro maganda kung before you ask your questions, you can say, "Hi, I'm Sab, I'm from Metro Manila, and ito ang question ko." Para naman meron tayong deeper connection, di ba? Meron bang mga nanonood ngayon na pregnant moms o di kaya may mga newborn na less than 6 months old? Because we have a surprise for you guys. Johnson's Baby is giving away Johnson's Cotton Touch gift packs. Meron akong samples dito. Johnson's Cotton Touch kasi ito talagang ginagamit ko, especially for Vito, who is 9 months old. But it's perfect from newborn pa lang. So we are giving away Johnson's Cotton Touch gift packs to 2 lucky mommies. So for pregnant women, pregnant moms out there, all you have to do is comment your nickname and how long you've been pregnant. Para naman sa mga mommies with newborns, just comment your nickname and kung ilang months na si baby. So kumare, I'm Sab and I'm a mother of a 9-month-old. Ayun, yun lang, guys. Pwede na kayong manalo ng Johnson's Cotton Touch gift pack. And we'll announce our winners at the end of our session. So good luck, mommies. Keep the comments coming. Any questions you have for our experts, we have an OB-GYN and a pediatrician. So perfecto for those who are pregnant and those who want after-birth care. Okay. We want to say hi to our mommies from Laguna, Rizal, Cavite, Parañaque. Oh my goodness, guys. You are so near yet so far. Namimiss ko na pumunta sa mga places na yan. Actually, my mom is from Rizal. So, matagal-tagal ko na siyang hindi nakita. Pero, nag-visit siya sa akin. Pero, syempre, we have to make sure we're all keeping our distance. We're staying at home, safe at home, diba? Okay, syempre, huwag nyo rin kalimutan i-comment ang inyong mga katanungan tungkol sa pagbubuntis at panganganak sa panahon ngayon. Ano bang mga questions sa mga tatakal natin mamaya? Meron kami mga pre-screened questions like, for example, ano nga bang pinagkaiba ng pre-COVID-19 and now that we're in the middle of a pandemic? Ano yung changes sa delivery room? All of these things we're gonna tackle later on. So if you have any other questions, make sure to comment them below. All right, how many minutes do we have? We have 5 more minutes, I think, before ipakilala ko ang mga makakasama nating doctors for today. So I'm inviting everyone to share this Johnson School of Gentle session, lalo na sa mga kakilala nyo na mga mommies na buntis o kaya ay bagong panganak. I know I have a good friend who's pregnant. She told me she saw this and she's definitely gonna watch. So, Nikki, if you're watching, hi! Shout out to you! I'm so excited for you kasi may magkakaroon na ng barkada si Vito and Pancho. Yay! Okay. Ano pa ba? Let's see. Ano may mga comments dyan? Hi to moms from Davao and Benguet and Quezon City. Hi, mommies! Hello! Nakakamiss ang Baguio. Actually, doon ako pinakasal. Gusto mo yung comment lang ako ng kung ano. Sharing lang, guys. Kamusta? Tell me more about yourself. Let's get to know each other. Okay, natawag na ba ang mga mommy friends nyo? Guys, ready na kayo? Are we game? Let's do this! Game na ba? Sige, let's wait a little more for the moms to come in. Or sige, ayan, mukhang ready na tayong lahat mag-start. Before anything else, I know we're all mommies here, most of us, but I want to say belated Happy Father's Day. Kung meron tayong mga fathers dyan na very supportive, who want to learn more, props to you guys kasi it's really a team. Hindi lang mommies ang kailangan malaman ng itong mga to kasi fathers, you guys are involved. May mga changes ngayon na nagaganap and I think it's best if you guys know what to expect. All right? Happy Father's Day, especially to the guys who are very, very involved. You guys, you set the bar very high. All right, let's go. Let's start. Magandang hapon ulit mga mommies. Hello to our viewers who are watching via the Johnson's Baby Facebook page and to our viewers who are watching via Shopee. Hi, Shopee! To those who have just tuned in, my name is Saab Magalona. I'm the mom of Pancho and Vito. I'll be your host for today's Johnson School of Gentle, where we invite different experts to ease your worries in this time of uncertainty. Okay, today we have invited an OB-GYN and a pediatrician to answer your questions about pregnancy, childbirth, and caring for newborns in the time of COVID-19. Okay, just to be clear, this is a J&J initiated Facebook Live and our guest speaker is a J&J hired resource speaker to discuss topics related to this. Joining us today is an obstetrician and gynecologist and chair of the section of OB-GYN ultrasound at the Cardinal Santos Medical Center, Dr. Kristine Tangco. Hello, Doc, all the way in Boracay.
Hi, Sab. Hi, everyone. I'd like to say hello to all of you who's watching us. I hope you're all safe and healthy in the comfort of your homes. Hi.
Nakakaingit naman yung beach nyo, Doc.
Oo nga nakakamiss, no? Mag-beach.
Sobra. Okay, as promised, hindi lang isa ang ating expert for today. Also joining us is a pediatrician at the Cardinal Santos Medical Center and the head of the Makati Medical Center Newborn Services Transitional Care SPICA Unit. And Dr. Lourraine Co. Good afternoon, Doc. Hi.
Hi. Good afternoon.
Thanks for joining us. How are you?
I'm okay. And good afternoon to the viewers. Belated Happy Father's Day. The fathers who are also tuned in.
Yes. Thank you so much for joining us today, Doc Kristine and Doc Lourraine. Are you guys ready? Kasi mukhang marami tayong mga katanungan na itatakle today.
Yes, I'm sure they have a lot of questions about giving birth at this time, kung ano mangyayari sa babies nila. So, yeah, let's do it.
Actually, I think both of you just came from the hospital, no?
Yes.
Morning.
From the hospital.
Yeah, wow. Grabe. Hardworking frontliners. Palakpakan natin. Yes. Okay. And to our mommy viewers, wag kayong mahiya. Don't forget to comment your questions about pregnancy, childbirth, and caring for newborns. Just leave a comment below. We'll try to answer as much as we can. And meron din kaming mga surprise na inihanda. Kaya stay tuned. Una sa mga inhanda namin ay ang special giveaway to pregnant moms and moms with newborns. Like I said earlier, Johnson's Baby is giving away Johnson's Cotton Touch gift packs to 2 lucky mommies. For pregnant moms, all you have to do is comment your nickname and how long you've been pregnant. Para naman sa mga mommies with newborns, just comment your nickname and kung ilang months na si baby. All right. Docs, are you ready?
Yes.
Shall we do this? Okay. Let's get to it right away. Before we go to the specifics, let's talk muna about how pregnancy and giving birth has changed. So, Doc Kristine, this question is for you. Para tong game show, no? Doc Kristine, this question is for you. Ano ang mga pinagkaiba pre-COVID-19 and now that we're still in the middle of a pandemic? Ano ba yung main differences?
Okay, the COVID-19 pandemic is a global crisis that has been very challenging for everyone, especially to the expectant moms. I'm sure they're all agitated. I could just imagine the stress and the anxiety that they're feeling at this point. But you don't worry because your doctors and the hospitals have been making guidelines and changing protocols every day to make it safe for you and your baby. But it's not exactly the same to deliver as it was before anymore. Of course, everybody has to wear masks when you go out of the house. So you're required to wear a mask in the hospital. When you go to the delivery room, you'd see your doctors and nurses and other staffs in their protective physical gears. So they're wearing bunny suits or hazmats. They're wearing face shields and goggles. They're wearing masks and caps and booties as well. Also, when you're about to deliver, when you reach your term, if you're going to do trial of labor on the 37th week, you're required to do a COVID swab, the RT-PCR. Depending on the hospital, if the hospital is not too strict, sometimes they'd allow that result until you deliver at 39 weeks. But some hospitals would not allow it. They'd require you to do another swab on the 39th week if you have not delivered yet. Okay. If, for example, you're scheduled for a cesarean section, you're required to do your swab maybe 5 to 7 days before the scheduled date, depending on how quick the laboratory can release your result.
Usually, gaano katagal ba yun, Doc?
In our hospital, usually 48 to 72 hours may result na eh.
Okay.
Yeah. And then nowadays, unfortunately, husbands are no longer allowed to go inside the delivery room because we need to maintain the sterility and of course, to avoid overcrowding of the unit.
Yes.
Also, one of the main differences in delivering now is that an acrylic box, a clear acrylic box might be placed on top of the patient's head. So in my practice, I make sure na nakikita ako ng pasyente ko bago ilagay yung box. And during while the box is being put over her head, I stay with her kasi na yung anxiety wala na nga si husband, tapos lalagyan pa ako ng box on top of the head. But it's for her protection as well.
But it's clear, no, Doc?
Clear, yeah.
Clear naman. But of course, there's still that What else?
The major differences in giving birth nowadays and before.
Okay, wow. That's such a huge thing na the fathers are not allowed in the delivery room anymore.
Yeah.
Both of my deliveries, my husband was there. So I understand how anxious people are, the moms right now, the pregnant moms. But again, we're not here to scare you guys. We're here to inform you para you're ready for whatever it is that you need to expect when you give birth. Okay, what about after giving birth? Doc Lourraine, our pediatrician expert, we have a question for you. Do we still encourage moms to hold their babies? Kasi alam ko, pre-COVID, it's very, I don't know if it was mandatory. I believe it is. But right after ipanganak, kung wala namang complications, ilalagay ka agad sa mommy, diba? So is that still a practice that's happening right now?
Yeah, Saab, I heard you earlier saying that you gave birth by cesarean section.
Yes.
So pre-COVID, whether it's cesarean section or vaginal delivery, we always have 4 fundamental elements to encourage that the mother and the baby remain as a unit. Because they were a unit, just one unit for 9 to 10 months. And right after the baby has been delivered, we would like as much as possible for that union to remain the same for the next 4 to 8 weeks. So, first of all, skin to skin contact. Second of all, breastfeeding, if we could start it, which we call latching at the delivery room. And then the cord is cut at at a time that is both beneficial for the mom and for the baby. And it's called properly timed cord clamping. And finally, so skin to skin breastfeeding. And then we try to always not separate the mom from the baby.
Doc, just to clarify, this is pre-COVID? Yun yung protocol?
Yes.
Pre-COVID.
Yes.
Okay. And then you will tell us what's the difference now?
Yes.
Okay. Yeah.
We tried to, Saab, we tried to keep those 4 elements intact. We did not want to, for the sake of the baby, really, we did not want to tamper with those 4 important elements. First of all, the skin to skin. She's been with mom. The baby has been with mom for the past 9 months. And hearing the mother's heartbeat all through those 9 months, the skin to skin contact gives the same effect. And the warmth, we don't need to put the baby in an incubator or a radiant warmer or artificial lights. The warmth that the mother's body emanates is the warmth that the baby feels. Then breastfeeding, of course, through latching. In the delivery room, it's latching because the obstetrician, Dr. Kristine, has to finish her work. And there are some surprises where we put the baby onto the chest and the baby starts to latch and actually breastfeed for even as long as 15 minutes. And we don't disturb that.
Yes. Ang tawag doon, di ba unang yakap? Unang yakap ang tawag doon?
Yes. Essential Intrapartum Newborn Care, EINC, and in Tagalog, it's called Unang Yakap, which has been brought to, which was started in the Philippines and is now in so many continents and countries, and we're so proud that we were the ones who started it.
Oh, I had no idea. Wow.
We started it. But in neonatologist, Dr. Amian Silvestre has been going around the world in Scandinavian, African, ASEAN, North American, and South American countries. And the book on EINC, or Unang Yakap, has been translated into no less than more than 70 dialect languages. So because of the proven benefit that the baby as well as the mother gets from those 4 key elements.
So sorry, Doc, the 4 key elements, the skin to skin,
breastfeeding, non-separation.
Non-separation. For how many hours? Right away. No? I mean,
non-separation until rooming in. Yun ang gusto namin.
Okay.
Non-separation, nasa DR. The baby isn't brought anywhere. The baby is in the DR. And then, after that, RR, the baby is still with the mom. And then, when the mom is in rooming in, sasama na rin si baby. The baby goes with her to the rooming in.
What's the 4th one, Doc?
So it's breastfeeding.
Sorry, it was
continued breastfeeding. It's latched kasi in the DR inside. Oh, sorry. The 4th one is for us, Mina Kristine, is properly timed cord clamping, which is really the decision of the obstetrician, depending on the condition of mom and the baby.
Okay, sige. Thank you, Doc. Thank you so much. So, just to confirm, you definitely encourage skin-to-skin contact even during the time of the pandemic?
Yes. We tried to keep all those 4 intact, Sam. Even though in the beginning, in March, I think we started in March, end of February and March. Everybody was depending on Wuhan, China's research output to determine all their guidelines. And I'm telling you, Sam, I have changed the guidelines for the nursery of Makati Med and of Cardinal 5 times because in the beginning,
Hinihiwalay yung baby, no?
talaga.
Yes, oo.
Hinihiwalay hanggang umuwi.
Oh, wow.
And even at home, they were supposed to be apart from each other, and a designated caregiver had to take care of the baby. Not only...
I'm sure that's very frustrating for the mothers, especially I know from my research na kahit kumari if I'm feeling sick, of course not COVID, diba, you're still recommended to continue breastfeeding kasi your breast milk has the antibodies to take care of your kid. So I'm sure, I mean, it's very good that you were able to change the guidelines to benefit the mothers and the kids. Before anything else, I want to say hi, guys. We are at 1.6 viewers na. We have 1,600 people listening and watching us. Kaya naman, here is our special treat for you. When you buy Johnson's Cotton Touch Wash and Lotion in Shopee today, you will get 10% off just by using the voucher code SOG Johnsons. You can see the full details in the add to cart now, mommies. All right. Thank you, guys. Thank you, Doc Lourraine. Thank you, Doc Kristine. Yes? Oh,
No.
did you... Okay. Okay. Let's talk about checkups. So a lot of our pregnant moms are scared to go to the hospital kasi nga there's a risk of getting the virus. But the question is, meron bang mga prenatal tests na pwedeng i-skip? Doc Kristine, this question's for you.
Okay. Thank you, Sam. So ideally, you go to your doctors monthly until the 28th week. That's until 7 months. From 7 months until the 36th week, which is the 9th month, you go to your doctor every 2 weeks and then weekly thereafter. That's the ideal way of doing your checkups. But since this is the pandemic, I understand some are hesitant to go out. They don't want to be exposed to the hospital because of this virus. So I do suggest 4 face-to-face consultations with your doctors. 4 important...
For the whole 9 months?
Yes. All the others, they can do online consultations with their doctors. If their doctor allows it, they can do online consultations. This is considering they're not high risk.
Yeah.
They don't have any medical complications like diabetes or hypertension, and the baby's growing normally. Yeah. So there are 4 important face-to-face consultations with their doctors. The first one being in the first trimester when they just find out that they're pregnant. So that's the time they need to do their transvaginal ultrasound, wherein they would know how many pregnancies they have. Is this a singleton pregnancy or are they having twins? Does the embryo already have a heartbeat? When is she giving birth? The exact date will be printed in the ultrasound. This is also the time that she needs to do her baseline blood tests, her complete blood count, her urinalysis, her HIV test, and the Hep B test, etc. So she then needs to go to her doctor for interpretation of the results. And this is also the time that the doctor will give her multivitamins, her calcium, her folic acid, etc. So the second visit, if everything is unremarkable, her second important prenatal visit should be done between the 24th to the 28th week, between 6 to 7 months. Because this is the time that usually the doctor would request for her 75-gram OGTT, everybody's favorite, ipapainumin ng matamis, kukunin ng blood twice to screen for diabetes. This is also the time that her congenital anomaly scanning, a special kind of ultrasound, will be done to check if the baby is okay from head to toe. So she again needs to go to her doctor for interpretation of her results and to be checked up.
Yes.
The third important visit could be during the 35th to the 36th week, just about near term, so that she again can get her CBC at this time for the doctor to have an idea if she's having low blood, if she's anemic, or is her hemoglobin enough for her delivery. Mm-hmm. And another ultrasound can be done at this time just to check if the baby is doing well. Is the amniotic fluid normal? Is the placental location normal, or is the placenta low? Is the baby growing appropriately for age? Is the baby breech or encephalic presentation? So those are the important things that her doctor needs to know near term.
Yes.
And the last visit could be during the 38th week, with or without ultrasound, because at this time the doctor needs to do an internal exam and assess her if she's about to go into labor or later on pa. So in between these 4 important prenatal checkups na face-to-face, they can probably do an online consultation if the doctor will allow it. Or if not, if there's no means, let's say they live in the province and they have to get a lot of passes or certificate to go around and they can't go out, all they have to do is just do fetal movement counting.
Okay.
The American College of OB-GYN states that the baby is in good well-being if the baby moves at least 10 times in any 2 consecutive hours of the day.
Okay.
So when you just finish eating, galaw na ng galaw si baby. So that's more than enough to say that the baby is okay.
Okay, so for example, 12 noon, from 12 to 2, dapat nakapag at least 10 movements,
Yes.
baby.
Yes.
At
Yes.
around what, ilang weeks to?
When you start feeling the baby's movement, maybe 22 weeks onwards. Di ba? For preemies, it takes longer for you to feel the quickening.
Yes.
So may konting leeway, 22 weeks onwards.
Okay, 22 weeks onwards. Okay, mommies, remember, 2 consecutive hours. So whatever time that is, kung nafe-feel nyo gumagalaw siya ng madalas patulog kayo, ayaw kayong patulugin, kung maka 2 hours, in 2 hours, meron siyang 10 movements at least, that means okay naman si baby.
Yeah, I always tell my patient, when my patients come for checkup and they say, "Hi, doktora, hindi ako nakatulog kasi sobrang galaw." I always say, "I'm happy."
Yeah.
I'm happy
There's also such a thing as too much movement, Doc. Is that right?
The more movements, the better.
Okay. All right. Sige. Wow, alam nyo, when you were talking to me, talking through the steps, the ultrasounds, I had a smile on my face kasi nga I remembered my prenatal checkups and everything. And it's nice the first time you hear the heartbeat. But I can imagine the moms right now, they're very anxious because they don't know what to do, especially the first time mommies. But I want to remind all the moms out there na it's very important for us to just kind of step back and relax and calm down, because the negative energy that we feel, that's probably going to be passed on to your baby that you're carrying. So instead of worrying and just always being scared, I think this is a great first step that you're watching this School of Gentle session right now, because you're being prepared, you're answering these questions that you have, and I hope that we're helping you in any way that we can. All right, thank you so much to our experts. We have more questions, mommies. Sino ba tong isang nag-ask? Okay, sino ba nag-question? Sino ba nagtanong nito? Follow-up question from our mommies who are watching. Is it safe po ba sa mga preggy na magpa-vaccine ng mga anti-flu?
Flu vaccines are safe for pregnancy.
Whatever week?
28 weeks onwards is safe. Yeah, because it's an inactivated virus. It's not like the MMR na live siya na minsan, di ba, pwede ka pang lagnatin. The flu vaccines are pretty safe for pregnancy because it's not live.
Okay. So, but they have to wait until they're 28 weeks at least.
Yeah. 26 onwards.
26, sorry. Okay, 26 weeks onwards. Okay. Let's say, what about yung checkups for yung babies na nga mismo? Once the baby is discharged, Doc Lourraine, is the mom still encouraged to visit her pedia? Ano ba yung mga kailangan na physical checkup? Gaano kadalas to dapat mangyari? Can these checkups be delayed, yung mga vaccinations ng babies? Please walk us through it. Hi, Doc Lourraine, I think you are muted.
Let me just say that there's a difference now between pre-COVID and COVID discharging of infants. Pre-COVID, they're given, as you remember, siguro Saab, the babies were given BCG, hepatitis B, the hearing screen was done, newborn screen was done, and you were told to return if you are cesarean section probably 1 week after you've been discharged with your baby. In our present scenario, since March, if the mother is very ill, we send because of some reason, not necessarily COVID. If the mother is really ill with COVID or another illness, then we send the baby home right away. And in order to deter transmission of the virus from the hospital to the baby, because we haven't proven yet any transmission from the placenta or amniotic fluid to the baby. So if there are cases that have been reported, it is usually from the community or from somebody in the house who has COVID. So the difference now is that we want to send the baby home right away, even if the mother isn't ready yet. If we can send the baby home as early as at the 48th hour of life, with the mother still in the hospital, we would. And we want the consultation to be on a daily basis through teleconsult. We want to see the baby with the designated caregiver or with the mother. The immunizations, if they can be given like before, when the baby is born, like BCG and hepatitis B, it is given, and vitamin K as well. Ngayon, for the succeeding vaccines, should there be no problems with medical disease on the part of the baby and on the part of the mom, then it can go on as usual, which your own pediatrician can explain. The primary series is the first one. So, of course, you really have to not just teleconsult with the pediatrician. We welcome teleconsults, but if it's time for vaccinations, we're really so firm. There's no, we do not give any leeway or excuse for not bringing the baby in for a vaccination, whose benefit outweighs the risk of bringing the baby back to the hospital.
Especially pag newborn, no? When they're a little older, it's okay to delay yung mga pang bigger babies, no?
Yeah.
Yeah, oo. Kasi with my baby, we delayed it a little bit because nga he was already 7 months old, and then sabi naman pwedeng kasi we were all on lockdown pa, very strict lockdown back then, but then okay naman. Ang nangyari, we did a drive-through, doc. Buti na lang our pediatrician lives right down the road. Oo. So
marami, yes, you have to be innovative.
Yes.
But in this day and age where vaccinations are taken for granted, they think that just because everything stops, the vaccination can wait.
Yes.
Sorry, it cannot. And that is why pediatricians have resorted to innovative ways of delivery. But recently, the PMA as well as the PPS has released a memo that please don't be taken in by unscrupulous and shady individuals who are not certified to administer such biologicals.
Yes.
Ang dami talaga. Sa Facebook, if you just type vaccine home service, a lot of before, no? Ngayon, it's been taken down already, but before, ang daming and they're not even doctors. They are non-MDs.
Wow.
So,
wow.
Yes.
So your advice would still be, kasi I know there are a lot of moms who are afraid to go to bigger hospitals kasi nga andun yung mga COVID cases, but then what you would advise is kesa yung mga small time na hindi certified to administer these vaccines, mas dangerous pa yun.
Yes. First of all, they're not supposed to be in possession of these vaccines. Mm-hmm. There is a memo between the Philippine Medical Association and the Philippine Pediatric Society, as well as the distributors of these their live viruses and bacteria, Saab.
Yeah.
And they're not
Does it have to be refrigerated or something?
There's a strict temperature cold chain that is followed if you're in possession of such biologicals. And you just can't put them in the fridge. They have to, like for example, in Cardinal, sometimes we rely on cooling because somebody has a refrigerator that has a temperature reading. And these vaccines, the different kinds of vaccines, have different kinds of temperature storage recommendations from each manufacturer. So if you, for example, a polio needs to be 0 to minus 10 degrees, is placed in 4 degrees, you automatically denature the biological and giving the oral polio, or kasi nga, yung iba oral polio, if you give the oral polio, you might even end up with vaccine-associated polio myelitis. So it is not fun to look for. It's not fun. It's not recommended to go to Google or to go to Facebook and search for home service vaccinators. Because first of all, where is there the certification and the training? Even if you do have the certification pala, do you know what you are injecting?
Yes. Oh, tama.
Madaling magturo, it's very easy to instruct a person how to inject intramuscularly. What is difficult is their understanding of what they're actually giving.
It's good that you clarified this, Doc. I think this is new information for a lot of moms. So thank you for sharing that. Okay, now moving on. Are all pregnant women who will be giving birth required to undergo testing for COVID-19? Doc Kristine?
Yes, everybody's required to undergo COVID swab, the RT-PCR. The Philippine Society of OB-GYNs has released a guideline about this. So all OB-GYN patients must undergo the swab.
Okay. And what about the babies?
The babies...
Let's say scenario A, the mom tests negative.
Okay.
What happens? Will the baby still be tested?
Okay. Kristine, you have something to say before I say? Okay.
It's okay, Doctora.
Sige, ganito. When the mommy is thankfully, pag nag-negative siya, what happens, Doc Kristine?
So we just wait for her to go into labor.
Okay.
If she's scheduled for a cesarean section, we just schedule her right away.
Okay, and then Doc Lourraine, once she delivers, even if she tested negative for COVID, what happens to the baby? Is the baby still required to undergo testing for COVID?
If the baby is stable and well, there's no need. Okay. The latest is there is no need. But if the baby comes out with pneumonia and respiratory difficulty, breathing difficulty, then aside from the usual workup that we do for the normal bacteria, we also have to test for COVID, unfortunately.
And is it a difficult test?
Oh, no, not really. If we only do nasopharyngeal and oral, which means nose and mouth. In China, they use rectal swabbing, but we don't. So after a while, you get used to it, and hopefully the results are accurate with the skill of the residents who do it.
Okay.
The doctors who do it.
Okay, but if, let's say, unfortunately, if the mom does test positive before she gives birth, what happens then, Doc Kristine?
So if the mom tests positive, if we can wait 2 weeks, 14 days, we ask her to repeat her swab.
Okay.
As much as possible, we wait for her to become negative.
Is she confined right away?
It depends on her where she lives. It depends on her LGU.
Okay.
If there are some LGUs that if the patient is asymptomatic, we just allow them home quarantine. But there are some LGUs who require them to be
in a quarantine facility.
Isolation facility, yes. So, but in the event that she's positive and within the 14 days that we're waiting for her next swab, she delivers, we automatically deliver her in the negative pressure room in the hospital and then admit her in a COVID positive floor.
Okay.
So she's separated from all of the other patients in the hospital.
Okay. Doc, Lourraine, if the mom is positive, is the baby assumed to be positive or may iti-test pa siya separately? What happens?
No, the baby isn't assumed to be positive because, like I said, there had been very, very scanty evidence to show that the
virus
can be passed through the placenta and the amniotic fluid. As a matter of fact, the most recent research came out that the amniotic fluid itself is a denaturizing agent for the RNA of the virus itself. Simply put, yung amniotic fluid can actually weaken the viral pathogenicity, the viral illness. Mm-hmm. So, lalo talagang konti yung evidence that it's passed on from the mom to the baby. Usually, yung lumalabas na cases, Saab, are those that the babies had gone home or the babies are still in the hospital and they acquire the virus from, if they're in the hospital, another healthcare worker or another adult. If they are at home, they get it from a relative who is staying in the house who happens to be a symptomatic carrier.
Okay, but so if the mom is positive, the baby will still be tested.
Yes. If the mom is positive, whether the baby is stable or not, dumating kay Dr. Kristine, confirmed positive siya, and the newborn unit is alerted. We already prepare because if the mom is talagang confirmed positive the day before or on the day that she will deliver, then the baby has to be swabbed. Dati, ang sinasabi Saab is at the 24th hour of life. Parang Cinderella, 24th hour of life or not. But now, they find that if you do it on the 24th hour of life, which is 1 day old, it's contaminated pa with mother's droplets. So they prefer it to be between the 24th to the 36th hour of life.
Oh, okay.
Positive si mother.
Okay. Yes. So, just to recap,
summarize.
Let's say mommy tests positive, unfortunately, for COVID, either asymptomatic or symptomatic, regardless. And then she gives birth. Hindi na nagkaroon ng 2-week period. She gives birth in the time na nag-positive siya. The baby will also undergo COVID testing, but between 24 to 36 hours of life, because if it's anything before that, it could be just droplets from the mom.
Yes.
Okay. Wow, I'm learning so much. Thank you. Okay, wow. Okay, so before we go to the hospital, kaming mommies were always advised to pack a mommy baby bag, diba? So in this bag, we have, of course, our Johnson's Cotton Touch. And aside from that, my question is it advisable for moms to bring their own PPEs?
They can bring their own PPEs in the form of mask, goggles. Is that what you're saying? Or pati yung the
gown?
Well, if they're just going there to do their laboratory test or their ultrasound, yeah, why not? They can. When they're admitted, Saab, they have to wear the patient's gown of the hospital. So they might not be allowed to bring in their PPEs anymore.
So, and si mommy, when she's about to deliver na, she doesn't need to wear PPE because everyone around her is wearing PPE, right?
She doesn't have to be in PPE. No, just the mask and the acrylic box that I told you about a while ago.
Yes. Wow, so naka-mask siya while delivering?
Yeah. Yes.
Oh, wow. Okay. Okay, that's... Wow. Okay. Again, I think we tackled this, just reminding all the moms who just came in. Unfortunately, daddies are not allowed inside the delivery room. I know it was just Father's Day yesterday, but unfortunately, dads. What can you advise? They can still go with the mom, just not inside the delivery room, diba?
Yeah, they'll stay in their room, in their admitted room,
Okay.
but not the delivery room.
Daddy needs to wear PPE?
In the hospital, in the room? No.
Yeah. Oh,
just
no.
the goggles.
Just the mask and the goggles.
Because if the mom is COVID-free, COVID negative, she will be admitted in a COVID negative floor. So lahat yun COVID-free. So there's really no need for...
Even the dad has to be tested ba?
No naman, no.
Okay. Okay. Sige, so maraming mommies ang nagtatanong, is home birth a better option now since there are hospitals that scare these mommies?
Actually, for the pandemic, I've always advised patients to deliver in a hospital because the hospital is always more sterile than in the house. When complications arise, the hospital is still more equipped than delivering in a house. Could you just imagine delivering in a house, tapos all of a sudden, complication arise. So tatakbo ka yung stress and the traffic that you have to be just to go to the hospital. When you're in the hospital, everything's there. If there's an emergency, we just wheel you inside the delivery room or inside the OR, and everything is reachable everywhere. There's blood in the laboratory. The nursery is just a few steps away from the labor room.
Yes. I think siguro doc, no, there are moms kasi who prefer less invasive everything, like more natural talaga as possible. And I think there's nothing wrong with that. But then you can find an OB who has the same mindset as you, siguro, who believes in the same thing. And then you can still do it in the hospital. But
you can still do it in the hospital. You can still do lamas in the hospital.
Yes, at least you're protected if anything should happen. It's all available, diba? And okay. Sige. Aside from yun nga, if the mommy has the masks and everything, ano pa ba yung mga kailangan na nasa baby bag ni mommy?
Of course, the baby's clothes, diapers, mittens, and the most important thing is the gentle newborn wash. They have to put that inside the baby bag.
Like I said, yes. For our newborn skin, we only choose Johnson's Baby Cotton Touch Wash and Lotion. Johnson's Cotton Touch is Johnson's best hypoallergenic care for newborn sensitive skin. And this has been what I've been using for Vito. And actually, si Pancho rin when he was born. And it's just so fun kasi when you give birth, tuturuan ka talaga doon kung paano papaliguan si baby, and nagkakaroon ako ng flashbacks. And it was so nice kasi, diba, gagamitin mo, tapos may small cotton balls, and aanuhin mo yung baby. Oh my gosh. Oh no, baka gusto ko na naman magkaroon ng isa pang baby. Wag muna. Wag na muna. Okay, hintayin muna tayo ng vaccine ng COVID. Pero, yes, there's also the face and body lotion, not just the baby wash. There's also the lotion that's gentle enough for your newborn baby's skin. And even the face, hindi lang for the body, pero it's gentle enough for the face of the baby. So again, I encourage you guys to buy Johnson's Cotton Touch Wash and Lotion in Shopee today because you can get 10% off just by using the voucher code SOGJohnsons. Add to cart now, mommies. Okay, before we end, we have a couple of questions. Magkano tayo? Fast lightning round tayo dito. Okay, tignan natin kung ano yung mga hindi pa natasagot ha. Wait lang. Okay, ano ang mas safe ngayon for lesser risk of COVID transmission? CS or normal delivery? I think that's for you.
COVID-19 is not, being infected with COVID-19 is not an indication for a cesarean section. Mm-hmm. So every woman should be given a chance to do trial of labor and do normal delivery. The same indication for cesarean section is still applied. So COVID-19 is not an indication for cesarean.
So you mean regardless, dapat naman talaga i-try muna ng normal. CS is just like if there are any high-risk complications, it's like the last resort. You do CS.
Yes, they come in if there are indications like non-reassuring fetal heart rates or arrest in the dilatation or the descent of the baby's head. So the same indications apply for all women, even if it's in the pandemic.
Yes. Okay. So again, just to clarify, we go for normal because of course CS is a major surgery talaga na you're open. So of course you're more prone to complications. So the answer would be normal, would be the lesser risk, no matter what, even if COVID or not. That's almost the lesser risk. Okay, we also have this question from someone in our comment section. Is it true na mommies and babies are only allowed 24 hours kapag nanganak? I mean, pag pinanganak si baby, 24 hours ang maximum na magstay sila sa hospital? Are they kicked out after that? Kung, let's say, I think, assuming that they're negative.
No, they're...
Go ahead,
for mom.
For mom, if they deliver vaginally, I normally discharge them the following day.
Okay. Is that even before COVID? Ganun ba talaga yung sistema?
I normally wait for the babies. Usually 48 hours before pinapauwi si baby for the newborn screening, right, Doctora? And then for the cesarean sections, I normally discharge them 48 hours after the delivery.
This is ngayong COVID?
Yes.
Okay, sige. So 24 hours for normal vaginal delivery and 48 hours for cesarean. Doc Lourraine, do you want to add anything to that?
The only reason why I'm thinking of scenarios where 24 hours the baby and the mother are already asked to leave the hospital unless there's an outbreak and baby and the mom are both well, and they are asked to come back as early as the next day for the missed newborn screen, the missed hearing screen, and there must be a reason for some obstetricians and pediatricians to send them as early as they could. And sometimes it's also a shared decision with the parents that they be discharged as early as possible for some personal reasons at home. But we always have asked them to sign a waiver or a consent form that they had been fully informed that the baby has to be seen.
Yes.
As early as 24 hours after they had just gone home. Because the problems that occurred pre-COVID and post-COVID are the same. And that's jaundice, and that's very little breast milk until the baby becomes dehydrated. So all of the cord becomes infected. The meconium or the very first stool has not been passed. The urine has not been passed. So all of these things, if parents request to be sent home right away, they have to sign something to assure us who are looking after the dyad, the mother and the baby dyad, that they will come back as early as they could, the next day if possible, to make sure that the problems that are being monitored up to 48 to 72 hours are not there. Okay. And especially, yung mga first-time moms. We don't send them home at 24 hours if we feel it's dangerous for the baby and the mother as well.
I'm thinking, Doc, I think that would be the case if the hospital is trying to keep some rooms free for, a possible COVID victim siguro, ganon. Kaya sila pinapauwi ng 24 hours.
If the mom, so for example, the mom kunwari positive si mom, no? And she's well, tapos si baby is also well, no? So both have been swabbed, and I think Kristine, you had that baby admitted at the extension who
Yes.
went home so early. The baby went home so early,
24th.
together with the mom, right?
Yes. Opo.
The thing is, they were asked by the pediatrician to call her on a daily basis if they cannot physically come back to the hospital. Sab, this is normal. I don't call it new. I just call it now. Now this is normal. That if they should go home, they should call or do this. Have a face-to-face consult with their healthcare provider. In the mother's case, it's Kristine. In the baby's case, it's the pediatrician.
Yes.
So, yes, there are cases where they are sent home at 24 hours, especially those in the lying-in.
Yeah, I think the most important thing is that moms are preparing even before they give birth, so that all of these things, that even if you are unfortunately kicked out of the hospital because for some reason you can't stay there, then at least you're well informed. You know, read all the forms that your doctor gives you so you fully understand it, para walang mga pagsisisi later on, because you're well informed kung ano yung mga things that you have to look out for. And watching stuff like this, reading up on information even before you give birth would be the best way to take care of your baby. But Doc Lourraine, aside from the vaccines, the breastfeeding, proper nutrition, sanitizing the house, reading up on all of these things, what else is there to do to best protect your baby?
So, I've always told my patients that hindi pa tapos ang inyong pregnancy. I've always told them of the concept of the fourth trimester, no? Which has been coined by a pediatrician in 2000, early 2000s, no? And the fourth trimester are the 3 to 4 months after delivery, wherein the mother and the baby have to start to bond in such a way that they are separate and get used to each other without being connected. And the ways that you do that is, of course, breastfeeding, skin to skin. Aside from that, breastfeeding and skin to skin, you really need a lot of hygiene, especially in this day and age. You cannot do the usual, yung cotton nakalagay sa kahon, di ba? Nakalagay sa, yung white cotton na sa isang lalagyan, yung dry cotton na sa isang lalagyan. No, you really have to be obsessive compulsive at this day and age. And if you need to wash so frequently in between feedings, kasi gutumin niya mga yan. Breast milk is the most digestible of all the other substitute formulas that you have. Breastfeeding is so digestible that every hour or an hour and a half, the mom has to clean her hands, her breasts with soapy water, so that they're sure that they are ready for the baby to feed safely.
Yes.
Aside from that, breastfeeding, skin to skin, swaddling, and finally bathing.
Yes.
No? Bathing is the best way also to
protect the baby, no? Actually, ngayon, Doc, me and my husband, because he ako naman, I was used to staying here at home. I work from home and I'm purely breastfeeding. So I've been home this whole time. Kakapanganak ko lang rin, diba? So yung husband ko yung medyo may konting adjustment when he had to stay at home instead of going to business in his office. But now that he's at home, ngayon, nag-aagawan kami kung sino magpapaligo ng babies namin. But it's a good thing, di ba? Kasi it's really a great form of bonding between the parent and the child. So I think that's great advice po na you said that bathing is one of the best ways to protect your baby. And actually, I want to segue to keep our baby's skin healthy, it's important to use only the gentlest products for their skin, like the Johnson's Baby Cotton Touch Wash and Lotion. This is what I use for Vito. And sobrang magaan siya sa balat. I can't help it. You know, Doc, this is what I used when I was pregnant with Vito on my tummy. On my tummy, diba? Gusto ko maglagay ng lotion, diba? Para maganda yung skin mo. And ako kasi, I sweat easily. So, well, also si Vito rin also super sweats easily. So, this is perfect kasi hindi siya sticky. And magaan talaga siya sa balat. So, okay siya gamitan kahit mainit. And we all know how hot it is lately, diba? So, guys, I'm reminding you to please buy Johnson's Cotton Touch today. It's the wash and lotion are available in Shopee today. You get 10% off just by using the voucher code SOG Johnsons. Do yourself a favor, mommies. Okay, thank you so much, guys. Thank you for joining me. Mommy Lourraine, Mommy Lourraine, sorry. Well, Mommy na naman, di ba po? How many kids do you have? Tita, oh, okay. What about you, Doc Lourraine? Are you a mommy?
No.
No? Doc Kristine?
No.
No, not yet. Okay, sige. Doc Kristine, Doc Lourraine.
Anak ko si Kristine.
Are there any other things that you want to say? Reminders for the mommies who are watching right now? Doc Kristine, can we start with you?
Yeah, always make sure not to forget to take your vitamins, your iron, your calcium. Make sure the baby's moving a lot. The more, the better. If you don't feel the baby moving, please contact your doctor right away. If you feel something, please contact your doctor right away. And always sleep early, drink plenty of fluids, and most of all, don't go out of the house if it's not necessary.
Yes. Thank you so much. Doc Kristine, you mentioned a lot of things kanina, and if you mommies weren't able to take down notes, don't worry, because here on the Johnson's Baby Facebook page, we'll be posting all of the information that we got from Doc Kristine and Doc Lourraine. So make sure to follow this Facebook page, and the replay of this whole thing will be available later on. So Doc Lourraine, anything you want to say?
Well, the thing that I've already emphasized is that there is no stigma to giving birth. There is no stigma to giving birth right now, up to next year. With the virus looming over us, there is no stigma. You are in good hands with us. You are in good hands with our hospitals. Even after you leave the hospital, you are still in good hands with your physicians, and we want to still make, Kristine, di ba? We still want to make the experience of birthing and mothering the same as it has always been. Yes. And that they won't, and hopefully they won't feel the difference. Sa kami, marami. Kami sobrang dami na we have to adjust to so many things in our standards of care. Our standards of care. But this is the conclusion of that is we would like the parents, the mothers, the fathers to experience this to be the happiest experience of their life.
Yes. It's very unique, diba? And we will only come out of this stronger. Thank you so much, Doc Lourraine, Doc Kristine. You guys have been such amazing guests here on Johnson School of Gentle. And I mean, outside of this, you guys have done so much for all the mommies out there. And I personally want to thank you for being our frontliners and for just giving mommies peace of mind everywhere. Thank you so much.
Thank you
Okay.
for
Yes, before we end, I want to announce, diba kanina we said that we would be giving away 2 Johnson's Cotton Touch gift packs. We have our winners already. Yay! Congratulations to Mommy Fevy, who is 6 months pregnant, and Mommy Jambi, who is 33 weeks pregnant. The Johnson's Baby team will get in touch with you on how to claim your gifts, so don't worry about anything. They will get in touch with you. To the rest of our viewers, thank you so much for staying with us. Johnson's has a gift for all of you. Buy Johnson's Cotton Touch wash and lotion in Shopee today, and you can enjoy a special discount of 10% when you use the voucher code SOG Johnsons. Just visit the Shopee app, add to cart, input the voucher code SOG Johnsons today, and check out. Today lang yan, guys. So if I were you, I would really just, alam ko marami ng laman yung mga cart nyo, i-add din na lang to, okay? And in case you missed some of the important topics that we covered today, like I said kanina, watch out for the Johnson School of Gentle infographics that we will be releasing soon. So that ends today's Johnson School of Gentle session. Thank you once again to all the mommies who tuned in. Watch out for more Johnson School of Gentle sessions. And don't forget to follow Johnson's Baby on Facebook and Instagram to know more about caring for babies and your kids. Thank you, everyone. I'm Saab Magalona. You can follow me on Instagram. It's at Saab Magalona. Stay safe, stay healthy, and have a good evening, mommies. Bye. Thank you, Doc.
Thank you.
Bye.